In this section of the Un-Botched, we're going to be touching upon abnormal scarring. Abnormal scarring is an abnormal process of healing and is divided mainly into two classes. One is the hypertrophic scar and the other one is the keloid scar. When we talk about hypertrophic scar, it's a scar that is rather flat and really wide. The reason for this type of scarring is usually tension. We are used to close things under tension, for example in tummy tucks or other surgeries when there is a skin tension, and this can make you prone to develop a wide scar. Now the solution to this wide scar is rather simple. It requires what we call a scar revision. And if the scar is rather large, it might require more than 1 or 2 sessions of scar revisions called serial excision of scars. This is usually to bring your scar back to a thin line that is not very visible. In these cases, you might require that a certain time goes by, for example 6 months to a year, until your scar is mature to be revised. Now when we're talking about keloid scarring, this is a different process. Keloid scarring is an abnormal production and deposition of collagen that doesn't stop during the healing process. It continues to produce, and this creates a rather thick scar and raised above the level of the skin. So there are also treatments for this type of scarring that will include from just steroids injections to injections of anti-inflammatory drugs to just a scar revision, and in the cases that is super severe and it doesn't respond to any of this treatment, even radiation might be necessary. So know that if you have any of these two types of abnormal scarring, it's not because you have a botched surgery. This is an abnormal process of healing that can be addressed, and you should talk to your plastic surgeon about revising the scars, about the treatment that you can get, and hopefully you will decrease the tendency of develop this abnormal scarring in the future.